Hey, it's time for a talk of the town today here on AM 1390 KRFO. We're going to talk about the Homestead Hospice House. They got a wine and beer tasting coming up next week, and we'll meet Pat Buretta, who is now the new head person. I guess what's the actual title? Executive officer, head, boss, what
Manager.
There we go. That was so easy. Yeah, as Bill Donovan has retired, and you stepped on the job a few weeks ago, months.
August 3rd I started.
Okay, so you got a month ago
today? About a month under my belt, yeah.
Oh, maybe a little background about you, Pat. Let's meet you, the new manager of the hospice. Talk a little bit about yourself.
Well, thanks, Lauren. I am a Owatonna resident, and I've been working with Elena, as Lauren just identified, since August as the manager for the Homestead House and the Elena Hospice and Health Home Care Program. Prior to that, I have been working in an end-of-life residential hospice program up in Northfield, so I had some experience there. Previous to that, I'd actually been working with the Elena program as a nurse visiting patients, and I've also been worked with the Owatonna Clinic as the manager there for several years. So I've got an extensive nursing background in many different areas, but really excited to be back here in Owatonna working with this team and serving the community for hospice and home care.
It's nice when you can get a job in your hometown.
Absolutely. Yeah. That commute is 10 minutes away from my home now, so versus 45.
Anyway, a week from tonight, we have a fundraiser for the Homestead Hospice, and I'll let you tell us a little bit about it and how we get tickets and such.
Yes, coming up next Thursday, September 10th, we have our beer and wine tasting fundraiser at the Holiday Inn. It is from 6:30 to 9, and you can get tickets for $10 in advance or $15 at the door. And those tickets are available by our sponsors at Cashwise Liquor or the Cashwise General Service Desk, as well as we have tickets available at the Homestead House at the reception area.
Mm-hmm. And we can talk a little bit about where that money goes, and we'll explain me a little bit about how Hospice House is paid for. Let's say I'm terminally ill, heaven forbid, I'm now a resident. Talk about how it's paid for and then how it ties in with these funds you're raising next week.
Great. The Homestead House is funded and paid for by patients privately. The Homestead House is the residence for care, and we staff nursing there, and you have a private room. And get hospice specialized team that supports you, and that is paid privately. For those that do not have funds, that's where this fundraiser comes into place. It raises funds for what we call our patient care fund, and it provides support to individuals who are already on medical assistance or income eligible that cannot afford that private pay fee for the house. Patients in our home at the Homestead House are receiving hospice services, and that is provided by the hospice care team, and that's covered under Medicare. The residence is not, and so that's where those funds are so critical in supporting our patients in our community and surrounding areas who cannot afford that residence but really need that specialized care in that type of setting.
And we need to remember, they're talking people who are in their final days, final weeks, and you aren't going to come up with any money then if you don't have it already. So that, and I believe Bill said at one time you've never had to turn anybody down because they couldn't pay. Is that still true or not?
Absolutely not. Absolutely true. Yeah. We do not turn anyone down. We have been able to meet that need for those individuals coming to us and would welcome. And the community's been so gracious in donating in the past and have still a significant fund for those folks that need patient care funding, and so want to keep that going and be able to serve our community so no one is ever turned away.
I was just thinking, what was it like before there was such a thing as like hospice or hospice care? Was it simply a case if the terminally ill person, they'd just stay in bed at home and their family would do what they could? Is that what happened years ago? Do you know?
Yes, that would really be primarily how it was managed, or people would go to a nursing home, which is still the case as well.
Mm-hmm.
But the specialized understanding of how to manage the symptoms and getting the emotional and spiritual support is what the hospice programs really brought forward to make that death comforting and peaceful. But more importantly, our role is to really help people live to that last day and enjoy their life. And so, yeah, in the past, people would stay at home, be taken care of by their own families, no real availability of experts to come in and support them and train them on how to do that.
Because I'm just thinking, if you have pain, I wouldn't know what to do for someone who had pain. But, well, obviously you folks would. That's the thing I'm thinking about. Talk a little bit. A lot of folks haven't been to the hospice house. Just, well, maybe that's nice, a blessing. But what's it like for someone walking in? We walk into the hospice house. What do we see?
You see a home is what you see. It's a residential facility, and the community sponsored it, built a beautiful 8 private room home where you'd have your own private bedroom and bath and large community areas, dining room, living room, kitchen, a nice beautiful reflection room, as well as a family room that can accommodate families that would like to stay with their loved one at the facility on a short-term basis. We provide homemade meals. We do their laundry for them. We have nurses and nursing assistants around the clock providing care and management of their medications. The other thing that's so beautiful there is we have just gorgeous grounds around there, landscaping and wonderful paths that people needing some space and time can walk and enjoy the flowers and the scenery. We also have a beautiful spa and whirlpool bath, so we can give people a little extra TLC when they're there. And yeah, that's really what the house is like. You walk in, it just feels like a home.
Yeah, I would guess the employees you have, they've got to be special. I don't think not just anyone can do that, I don't think.
You really do have to have a passion for this care. And we do have wonderful staff. We have wonderful nurses, nursing assistants, and also we have a large cadre of hospice volunteers that are trained specifically in hospice care. All of our staff are trained that way so that they can really understand how to support individuals in managing their symptoms or finding resources to make these end days as special as possible.
And volunteers don't necessarily have to be skilled as far as doing hospice care. You have needs for other volunteers too, like gardening or cleaning?
Absolutely. The volunteers cover a broad range of services from generally volunteers do not do personal care. They may do companionship, sit with individuals, help them write letters, but we also have people that aren't as comfortable being with the individual but can support, like you said, gardening. At the Homestead House, we have a great team of volunteers that bake every day. So we always have fresh cookies or bars. They also come in and help us make breakfast in the morning. So yes, there's just a wide variety of things. And on October 31st, we are having a volunteer training. And so if anyone is interested in becoming a hospice volunteer, there is some specific training you do need to go through. And Tricia Johnson, our volunteer coordinator, would be happy to help entertain anyone that's interested in that program.
So just we'll give you a phone call and get lined up to get the specifics as far as time and that? Or?
Absolutely, and our number is 446-0936, and we can give you the specifics and the details of that program.
And even, if you want to try it, and, if you find out, oh, this isn't for me, it's no big deal, but at least just stop and find out a little bit about
Absolutely.
it. Yep. We're talking to Pat Buretta, who's the manager of the Homestead Hospice Fundraising, coming up a week from tonight. Who can go to the Homestead Hospice? Is it just for Steele County, or are there residents that can come from outside the area or not?
Anyone that's being serviced by a hospice program in our area can come to the Homestead House. I would tell you the majority of the folks that come to us are from our region in Steele County and Owatonna, but recently we've had people from Mower County. We do get a number of referrals coming from Mayo, Rochester, or Abbott Northwestern. So
that's a good point too. How do you determine who goes to Homestead Hospice? Who tells the person? Is it your doctor, or can you make the decision yourself, or how does that work?
For people that come to the Homestead House, they do need to be enrolled in the Hospice Medicare Certified Program. And to become eligible for that program, you must be, your physician would certify that you're in that need, and typically it's based on a diagnosis that appears today that you have 6 months or less to live.
Okay.
And if you qualify with that criteria, the physician can then order hospice. We've had many patients who contact us with just the question, and we welcome those as well, and we can work with their physician to verify if indeed they are eligible. To come to the Homestead House, you do need to be in that hospice program, and then you can have residents there.
Hmm. For those who get hospice care in their own home, how does that work? Will you have someone every day or once a week, or does it vary? And what does that person do who comes to your home for hospice care?
It's the person that comes to your home for hospice care is a team. We have a team of nurses, home health aides, social workers, volunteers, as well as our spiritual care. And they are there intermittently. They do not come and stay with you 24/7 around the clock. The nurse would make a visit probably twice a week, the aide twice a week, for about an hour. And so we provide hospice care in any setting. Hospice services can be provided in your own home, in a nursing home, in an assisted living, or at our residence hospice, the Homestead House. And so the hospice program is this team that comes and makes sure you have what you need during your end-of-life care. Symptom management, equipment, identifying resources financially or spiritually or socially. So it's a broad range of services we can provide individuals under hospice care. But yes, we come right to your home. The key of people being in hospice in their home is they do need a caregiver that is able and willing to help support them in their home if needed.
Hmm.
If that is something that is not available to them, that's where the residence hospice homestead house really meets their need.
And what's been good, numerous times you haven't just talked about the physical ailment, you've mentioned the mental state, the social state, the spiritual state, so you encompass the whole package. Maybe we'll just wrap it up, Pat. Again, a recap of a week from tonight, what's happening and when, where, and how do we get tickets?
We are having our wine and beer tasting fundraiser at the Holiday Inn, September 10th, 6:30 to 9. The tickets are $10 in advance or $15 at the door. The advance tickets can be purchased either at the Cashwise Liquor Store or their service counter or at the Homestead reception area. And all funds from the wine and beer tasting go to the Patient Care Fund at the Homestead House to support our individuals in our community or region that cannot pay for that residence stay. And we don't turn anyone away, as we said earlier, and would welcome people to support the wine and beer tasting. Also want to acknowledge Cashwise has about 90 distributors coming. And Holiday Inn, who is providing us the space, is also providing some food to cleanse your palate between that beer and wine tasting.
Okay, and that's our Talk of the Town for today here on AM 13.